Dr. Githinji, thank you so much for taking time to speak to us. Dr. Githinji joins us via Skype. Sir, thank you so much. How difficult is it to track this virus? Let's just perhaps begin with a general idea, paint for Kenyans an image, an understanding of how difficult it is to track a virus.
It's not easy because it's like tracking something you can see, and the people with the virus have no particular features that you can see. As you know, about 80% of all our people, even the ones we've actually identified in Kenya, the 700 plus, all, 80% of them have no symptoms at all. So it's difficult. You have to get somebody, test them. Then after that, you start tracing back all the contacts. And you know how informal people are. From one place where the people left, they have taken a matatu, they have gone to another place. So it's really, really difficult. And the team that's tracing is spending sleepless nights, 24 hours a day, trying to look for the contacts, for them to be quarantined so that they can be tested. It is not easy.
And here's the other thing. The behavior of Kenyans, Dr. has made this a bit more difficult, would you not say? I was looking at some of the statistics that is being shared coming from COVID-19, specifically on Kenya. Those that we've lost to COVID-19 here in Kenya, 45% are people who are 60 years and above.
That is true. I was looking at the statistics, and especially men who are above 60. If you imagine that so far in our total numbers, only 40 men above 60 have turned positive. 15 of them have died. So it is actually a serious issue. So people need to take this seriously. And I think what's going on is that we're still not seeing full community ownership. We are seeing people treating this as a government response, and then whatever measures the government is taking, it is how well can you evade the measures so that you continue with your life. And I think, the thing we really need to do is ensure that the communities own the response, and the way to own the response is actually for the people themselves, community health workers, the people in the community like the religious leaders, to actually work together. The Nyumba Kumi, all these people. The government cannot police everyone. People have to police themselves, and they have to know that they are doing so for themselves and for their loved ones and for the country as well. So it's also patriotic duty. Yeah.
And Dr. how much of our attitude as Kenyans, how much of our attitude and day-to-day practices has affected or contributed to COVID-19 and the curve that we are seeing? Right now, this week, Kenya hit the 700 mark. We are shy from hitting the 1,000 mark.
Kenya started well. We started well because we closed our borders very early. The next thing that we did right, which I had advocated for, is to limit urban-rural migration, because as you know, a lot of our elderly people are in the rural areas. So that has really helped us, because ideally our projections were that by now we would be in the thousands. Yeah, so that has kind of limited. But now what we are seeing now with the truck drivers means that actually a bigger percentage of people is infected than we think they are. So we have quite a few people who are infected that we haven't tested, and this number is also infecting others. Remember that coronavirus, one person who is infected will infect about 3 to 4 other people. So the spread, we know it's going on, and the attitude you talk about is probably a mistrust between the people and the government. It is that people don't believe this thing is going on. People also believe that there are other ways to treat it. They have seen herbal concoctions. But you remember, herbal is passed on in Old Town, which must tell people that actually, in fact, I think I saw someone saying they went to a herbalist and they found a sanitizer outside the door, which tells them that even the herbalists themselves don't believe what they're offering you. So it is trust between the people and the government. It is the myths that are actually affecting the attitude. And finally, it is also people think that people thought this would be burst into thousands overnight. No, it's going to go on, and we expect that we are going to get peaks into August. So we have not even reached the worst of the curve. We are still on a slow rise. So people need to understand this. But most importantly, the government needs to invest time and resources to get down to the people and let the people own the response themselves beyond just the declaration.
Dr. There's something that you've said that has caught my attention, and that's the curve. You're saying that for us as Kenya, what you're seeing, what you're predicting is that we are yet to hit the highest that could come around August. Is that the timeline? Is that what you're looking at, given what's on the ground that you're able to see?
Absolutely. And we expect, and we have seen some predictions by some of our scientists that we are working with that show that Kenya is likely to reach its peak around August, and probably this virus will go on infecting people up to probably end of the year. So we need to be cautious that that's going on. But we have to test people so that we can identify those and isolate them. Because once you identify the positives, the aim is to isolate them either in a public center or or at home, which is very controversial right now in Kenya. Yes. So for us, as AMREF and also with what we call the National Business Compact, we are actually trying to assist the government not only in reducing the spread through hand washing, behavior change. We are focusing a lot on behavior change. If you see, there are a lot of billboards in across the country. We are setting up thousands of hand washing stations in the community to change behavior. And that is through the National Business Compact for COVID-19 to ensure that we cut the spread so that even as it gets to August, we are not seeing a big peak, which makes, so many vulnerable people go to the hospital. People get infected. The important thing is how can we slow the rate of infection so that we do not overwhelm the health system. That's really what we are focusing on.
And here's the thing, Dr. Githinji, the fact that you're saying that our peak could come around August, does our own health systems here in Kenya, does our health system sort of help us allow to cope with the resurgence of COVID-19 if that happens to be the case in the near future? Does our hospital system, can we cope with that, a possible resurgence?
It's whatever we are talking about August will not be a resurgence. It's actually be the peak of this particular curve because that's the projection we have. And the health system, we know right now, as we say, remember that Kenya has only about 3% of people who are over 60. We have seen that overwhelming numbers of severity are above 60 years. So that's clear now, even from the numbers we have. Of course, we have people below that who are affected. We have young people also who have severe disease. We have other people who are below 60, but they have hypertension, they have diabetes, they may have cancer, so they're also going to be overwhelmed. But the large majority are the ones above 60. So if we keep our curve low, even if the peak is August, if we make sure that peak is not a high peak, it's a low peak, so that instead of having a curve that goes like that, you have a curve that goes in a more moderate manner and a flatter curve, then the health system is able to cope because we don't expect too many people out, even if you had hundreds of thousands infected, you don't expect too many people to require hospitalization, to require ventilators, to require ICU, to require oxygen. Majority of them are asymptomatic, and others, the ones who are symptomatic, might have mild to moderate symptoms, will require just a bit of care, which is why the government is planning to build isolation centers out of hospital so that they can leave the hospital to only deal with the severe cases. That's in plan.
And here's the thing, Dr. Githinji, earlier on you brought in the aspect of borders, and that the Namanga border has been a pain for Kenya and Tanzania as well. How do we go around this border issue? East Africa community has already put guidelines around the truck drivers. But what do you think, Dr. Should we should we not close our borders? Namanga border, to be specific.
For me, it's very clear. If you have a border, then anyone crossing the border is either tested or quarantined, and you wait to test them. For me, there are no two ways around that. And what's going on with the borders? Of course, there is a big issue of cargo flow. What we've seen in Uganda and in Uganda border, they are testing the drivers, then allowing them to go, but they are tracking the truck so that if they find the person positive, they're able to trace them and find them. That seems to be working. But the bigger challenge, other than the truck drivers themselves, is the communities along the borders and how they interact. And if we allow a porous border, we must create what we call safe zones on the border, an area of maybe 3 kilometers from border or 3 kilometers to the other border, where everyone in there is being screened, temperature, there are safe behaviors there, you have hand washing there, and everyone entering there, who they are, and you're actually testing them. So those safe zones around the borders are important, especially where there's a lot of cross-border trade that's happening, because that's a big risk. And you've seen, the truck drivers tested, 25 of them, 23 were Tanzanian. Luckily, they were left on the Tanzanian side. But how many other people who are not truck drivers, but they're actually crossing, and there's a lot of border trade happening? So we need enhanced surveillance along the borders.